Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to explore the price of intensity should nurses receive critical care pay. Let me start with a simple comparison. Two nurses start their shifts at the same hospital. One is working on a medical surgical floor, caring for 4 or 5 stable patients recovering from surgery or illness. The other walks into an intensive care unit. Her patient may be on a ventilator. Multiple medications are running through 4 pumps. Every heartbeat and blood pressure change is monitored second by second. Both nurses are highly trained. Both are providing essential care. But the level of acuity, the intensity of the work is very different. And that difference raises an important question. Should nurses working in high acuity environments receive critical care pay? At first glance, the answer might seem obvious. Critical care nurses manage some of the most complex situations in healthcare. They interpret advanced monitoring. They respond instantly to life threatening changes. They often care for patients whose conditions can shift dramatically in minutes. The emotional intensity is high. The responsibility is enormous. So many argue that additional compensation simply reflects the specialized skill and pressure required in these environments. But there's another side to the conversation. Healthcare is a team effort. Emergency nurses, oncology nurses, labor and delivery nurses, trauma nurses all face intense, high stakes situations in their own ways. If we assign extra pay to one type of acuity, where does the line get drawn? And does it risk unintentionally suggesting that some forms of nursing are more valuable than others? This debate isn't just about pay. It's about how we recognize complexity in healthcare work. Some organizations address this by offering differentials, additional compensation tied to specialty training, certifications, or high risk environments. Others emphasize career ladders and professional advancement rather than specific pay categories tied to acuity. But perhaps the deeper issue is this. Healthcare systems often struggle to measure the true intensity of nursing work. The emotional labor, the cognitive load, the responsibility for human lives. Those things don't always show up neatly on a payroll system. So maybe the real question isn't simply whether critical care nurses should earn more. Maybe the question is, how do we fairly recognize and support the extraordinary complexity of all nursing roles? Because whether a nurse is working in an intensive care unit, an emergency department, or a hospital floor, every shift requires skill, vigilance, and compassion. And every nurse carries the same ultimate responsibility, protecting the health and safety of the people entrusted to their care. The conversation about critical care pay isn't just about money. It's about how healthcare values expertise, responsibility, and the people who stand at the bedside when patients need them most. Thank you.